I see a lot of people tuning in. Thank you so much. I think we're just going to get started. So, hello everybody. Thank you for joining this presentation on COVID-19 workplace health and safety. We're very excited to have Chris back, WorkSafeBC's Director of Occupational Health and Safety Consultation and Education Services, to update us on some common questions and concerns regarding expectations as the province reopens. You can see with the box beside that there is a Q&A option. So if you have any questions, feel free to shoot your questions over there, as well as a general chat. So I'm going to turn my camera off now and get started. I also want to acknowledge that the weather is not great today. So if there's any internet issues, please bear with us. Thank you so much for your patience and see you soon.
Well, good morning, everyone, and thanks for joining. We've got about 40 minutes set aside here to be able to walk through primarily the COVID safety plan that is required by all employers in the province, and then talk about what resources you have available to be able to put that COVID safety plan together, and then we can open it up for some question and answer afterwards. So I don't have virtual access to the desktop from here, so I'm going to have to ask Ruby to advance slides as we go, so my apologies there. But Ruby, if you can go off to the next slide, that would be great. And just a quick agenda, a real brief understanding of COVID. We won't spend a lot of time there because I think most people are familiar with it. Developing your COVID safety plan and how to control for the risk of COVID exposure within the workplace, how you can access industry information. A few challenges that we've come across over the 6 months or so that we've been dealing with this issue that I want to bring forward, where you can access some support and other resources from WorkSafeBC and other organizations, and then Q&A. So we'll start off, Ruby, if you can go to, actually you can jump 2 slides ahead. We'll start talking about an understanding of COVID. Perfect. So, I think most people are familiar with what's on this slide. I'm not going to go through all the details here, but the key point that I want to bring across is actually in the bottom left-hand corner, that point that says that symptoms can range from mild to severe and can appear up to 14 days after exposure. And that's really what creates some of the challenge with this particular virus, is that it can sort of be latent within the body for about 14 days, where you, as an individual, if you are contracting COVID, then you can actually transmit the disease to others over that 14 days, even if you're not showing any signs or symptoms. So this becomes important when we're talking about control measures and things like temperature checks, as an example, as some employers have implemented temperature checks for either their staff or for patrons coming into the place of business, that isn't necessarily going to cover off your awareness of any exposure that or any risk of exposure that could be occurring within the workplace, because you may have people that are not showing any signs or symptoms but could still be contracting the disease. So as you're putting together your control measures, as you're putting together your plan, you want to ensure that you will have a range of control measures in place, and we'll talk about that a little bit more as we go forward. Ruby, next slide, please. So the other thing to take into account and really have a good understanding of is the various transmission factors and what increases the likelihood of transmission via person-to-person contact. So the first being probably the most important is around the challenges maintaining 2 meters of distance. And we're going to talk a lot about the 2 meters of distancing throughout today, and we do know that maintaining the 2 meters of distancing is one of the primary and most effective control measures in minimizing the transmission of the disease. But we also understand that many workplaces have challenges with the particular tasks or the particular activities that occur within the workplace to maintain that 2 meters. So recognizing that where you do have people coming within closer proximity of each other, then there is an increased likelihood of transmission, and we'll talk more about that later. Also, high frequency of unique people in the workplace. So this is a situation where the more people you have in the workplace, the higher the likelihood of transmission. So if you're in an office setting, say you have 10 people in your office and you don't really see the public throughout the day, then your exposure is really amongst the 10 co-workers that you're working with. Whereas if you're a restaurant or maybe a retail outfit, then you're going to have people coming in all throughout the day. And so an increased frequency of unique people or just different people coming into the workplace means that your increased likelihood of transmission will go up. Potential to work in enclosed areas. So we do know that outside is better than inside, and when inside, a bigger space is better than a closed space. So if you are in a tight space, then your increased likelihood of transmission will go up. We recognize employers don't necessarily have control over the size of their space, but you may have control over how the space can be configured within your settings. So we'll talk more about that when we get to control measures. Potential for sustained group interaction. We know that the longer people are within close proximity of each other, the increased likelihood of transmission. So trying to minimize exposure or minimize that time when people are within close proximity. Probability of infected persons. This is mostly applicable to places like healthcare, where your probability of having infected people within a healthcare setting is going to be higher than in other settings. And obviously that's going to increase the likelihood of transmission and may require more robust control measures. And the last one there, inadequate self-isolation practices, really speaks to the policies and procedures that you have in place as an employer, and you want to ensure that self-isolation is occurring. And I'll talk about that on the next slide. Down at the bottom there, where we talk about surface contact, surface contact really isn't seen as a huge risk for transmission, other than those surfaces that are regularly contacted. We're talking about maybe light switches or door handles, or maybe credit card machines, other things like that. They're going to be touched frequently by multiple people throughout the day. Then you do want to ensure that you have cleaning protocols in place, which we will also talk about. On to the next slide, please, Ruby. So if anyone within your workplace does experience signs and symptoms of COVID, they should be immediately informing their supervisor. They should be physically distancing from their colleagues and leaving the workplace, and then seeking medical attention from a healthcare professional. Obviously 911 if it's urgent, otherwise 811 for health advice, or even following the self-assessment tools and following direction from that. If we can go, and then consulting with healthcare providers before returning to work. And if we can jump to the next slide, we talk about employers and what the responsibilities are for employers if you have anyone in the workplace that is reported as having COVID. You want to ensure that, or at least signs and symptoms of COVID, sending the workers home to recover for the self-isolation period, cleaning and disinfecting their workstation or any workspace or tools or any other areas or things that they may have used within the job, and then following any direction from public health. And that's really key, is that if you have anyone in your workplace that does contract COVID, there will be contact tracing. You will have direction given to you from public health on what the next steps will look like there. Okay, we can jump to the next slide, actually really 2 slides ahead, because what we're going to do now is we're going to talk about the bulk of the discussion today, which is really around developing your COVID safety plan as an employer, which most of you are probably well along the lines of doing at this point. So we know that on May 15th, there was a public health order that was issued that requires all employers in the province of BC to create a COVID safety plan and post that COVID safety plan to those who are going to be utilizing the workplace. And that would include your workers, obviously. That would include any contractors or suppliers or service providers that might be coming into the workplace. And that would also include any clients, patrons, general public that might be coming into your workplace. And they do need to have access to that COVID safety plan. It doesn't mean that if you have a robust 20-page COVID safety plan that they need to have access to all 20 pages, but they do need to have access to what the general control measures are that you have in place as an employer related to COVID-19 exposure. The other thing, a couple other things I should mention on this slide. First is that there are a few exceptions to the requirements for a COVID safety plan. If you are under federal jurisdiction, then you are not required within BC to have a COVID safety plan. And the airline, rail, some other transportation employers may not be required to have that within BC. And if you are an owner operator, meaning that you are not required under our prevention mandate to have insurance through WorkSafeBC. So you are an owner operator, you don't have any employees, then the likelihood is that you are not required to have a COVID safety plan. If you're unsure whether or not you fit within those 2 categories, then best that you call WorkSafeBC, our general information line, and you'll be directed to our assessments team that will be able to help you with that. The other thing I should mention is that employers are not required to send their COVID safety plan to WorkSafeBC for approval. We're not reviewing or approving plans unless if we ask to review or approve them through an inspection of the workplace, where our officers would be coming out to your work site and doing an inspection. I'll talk about that approach a little bit later. Okay, if we can go on to the next slide. So understanding the orders, notices, and guidance on the Provincial Health Officer website is really important, and that's sort of your first step. If you just go onto Google and type in PHO orders, it will come to the page that gives you all the PHO orders, and they're listed in chronological order based on the newest issued order at the top. And ensuring that if you work in an industry that has specific orders for your industry, that you're aware of what those orders, notices, and guidance are before you start putting together your plan. So if you're in a food services establishment, for example, you serve food or alcohol, there are orders specific to your type of employment, your type of operation, and so you need to be aware of all of that, because essentially those orders are law, and it is a requirement to ensure that you're adhering to what's within those orders. Beyond that, it's really getting into the basics of physical distancing, cleaning and disinfecting, and personal hygiene. When we talk about personal hygiene, we're talking about covering your mouth or nose with a disposable tissue or the crease of your elbow when you sneeze or cough. Washing your hands often with soap and water for at least 20 seconds. So we do know that using soap and water is the single most effective way of reducing the spread of the infection. If soap and water are not available, you can use alcohol-based hand rubs, otherwise known as hand sanitizers. But you need to ensure that your hands are clean before you use those hand sanitizers. So if you've got dirt or grime or oil or grease or food all over your hands, then that disinfectant, that hand sanitizer is not going to be effective. So you do need to make sure you wash your hands, or at least rinse off all of that dirt and grime, so that the hand sanitizer can actually help to neutralize the virus most effectively. And that goes with surfaces as well. If you're cleaning a countertop or a desktop or a tabletop in a restaurant, and there's food and dirt or other things all over that desktop, dust maybe, you need to clean that off before you use any sort of disinfectant to ensure that disinfectant neutralizes the virus most effectively. You also want to ensure that you're not touching your face, eyes, nose, or mouth with unwashed hands, and not sharing any food, drinks, utensils, coffee, other items within the workplace either. Next slide, please, Ruby. So then we get into the 6 steps of the COVID safety plan. I'm going to walk through these 6 steps, and we have a template available for you on our website that will help you go through these 6 steps. And if an officer comes out and does an inspection of your workplace, they will expect that you will have gone through these 6 steps. So it's around assessing the risk in your workplace first, then implementing measures to reduce the risk, developing policies to manage the risk, manage the workplace, developing communication plans and training for your staff and others, monitoring your workplace and updating the plan as needed, and then also assessing any other risks that may become apparent as you resume operations. So I'll walk through each of these. If we can go on to the next slide, please, Ruby. We'll talk first about assessing the risk in your workplace. And this is really looking at things like, where do people congregate? What job tasks or processes require workers to come into close proximity with one another or with members of the public? What tools, machinery, or equipment do people come into contact with throughout the day? What surfaces are touched often? So really looking at every task, every activity within your workplace and asking yourself these questions, and looking at, again, understanding those transmission factors that I talked about earlier, and looking at where you may not be able to maintain the minimization of those transmission factors, and that's really where you need to identify all of that up front. The other key piece here is involving your frontline workers in this process. And actually, Ruby, I'll have you go to the next slide for this one, where this is really where we are talking about the inclusion of your joint committees if you have one, your worker health and safety representative if you have one, and if you are small enough where you don't require a joint committee or a worker health and safety representative, so 9 or fewer workers, you need to be looking at a way of including your workforce in one way or another, and that's up to you as the employer. So really, really important here. And we think about the fear, the fear associated with COVID. A lot of situations where people are fearful of coming back to work or exposing themselves to the public in any way. We've heard a lot about the return to schools at this point in time as we're in September. There's a lot of fear of coming back to the workplace, and it might be because people have an underlying medical condition, or they're caring for someone who has an underlying medical condition or is elderly. There could be lots of reasons why people are fearful. Including your workers in this process can go a long ways to allay that fear and to reduce the concerns that your workers have on what you as the employer are implementing as control measures. So including them in that process is going to go a long ways to having your workers come back to work in what they think is a safe environment to work in. Next slide, please. So after you've identified the risks of exposure within the workplace, all those activities where there may be risk, then you need to look at how you're going to control that risk within each of those situations. And for this, we really are looking at minimizing the risk of transmission through maintaining physical distancing, other measures where you're unable to maintain physical distancing, and then cleaning and hygiene. Next slide, please, Ruby. So for this, I'm going to talk about what we in our geeky safety world refer to as the hierarchy of controls. And what you see on this slide, I'm going to spend a few minutes here. What you see on this slide is our hierarchy, this reverse pyramid, where the most effective control measures are at the top under the category of elimination, and the least effective control measures are at the bottom of that reverse pyramid, which is PPE, or personal protective equipment. And that's where we talk about masks and gloves, and I'm going to come to that in a moment. But you'll notice that masks and gloves are the least effective control measures on this hierarchy. So I'm going to walk through this. Most effective being at the top, elimination. And this is for the purposes of COVID, this is really where we are talking about maintaining 2 meters of distancing. Is there a way of rescheduling work tasks or establishing occupancy limits or implementing work from home arrangements if you have the luxury of your staff working from home? Rearranging your workspace to create different flow in your workspace to maintain 2 meters of distancing. We know that if you can maintain 2 meters of distancing between people, you are essentially eliminating the majority of the risk. And that is key. Now, we also, again, recognize that there are situations where employers are unable to maintain 2 meters of distancing between their workers and co-workers or general public. And that's where you then want to consider some of these other types of control measures. So the next one down is engineering controls. And these are going to be the physical changes within the workplace that allow you to minimize exposure. So this is going to be like plexiglass that we've seen in grocery stores or many other situations. Plexiglass barriers or other barriers between people. So when you go and check out within a grocery store, you've got a plexiglass barrier between the cashier and the person that's purchasing their foods. And that actually creates a physical barrier where the droplets coming out of your mouth hit that barrier instead of transmitting across to the other person. But we also recognize that physical barriers are not always possible within all work settings and activities. So then we look at other types of control measures, which are administrative controls. Now, the reason that administrative controls are lower on the hierarchy is because they require behaviors of individuals. This is where you're putting in policies and procedures and rules. We go into grocery stores, again, I'll use that as an example, as all of us frequent grocery stores, that you go into a lot of grocery stores now and you'll see arrows in the aisles to try and create flow of people up and down the aisles. But how many times have you walked down an aisle following those arrows and someone walks the opposite way and isn't following those arrows? That is a control measure. It can be an effective control measure if people are following those rules, but it does require the behaviors of individuals, and we all know that we can't control anyone's behaviors other than our own. So this is why it's less effective than elimination or engineering controls, but are still important to consider as you go through developing your COVID safety plan. And then last on the list is PPE. There are situations where we are recommending masks be used. We're hearing that a lot from public health offices as well, that masks are becoming much more apparent as a control measure. It shouldn't be the only control measure, but in some situations you will want to be wearing a mask or are recommending that your workers are wearing a mask. So we do want to ensure that you understand that masks are most effective for you to control the transmission of your own droplets to other people. Depending on the type of mask you're wearing, it may not be covering or protecting yourself as a worker. So if you're in a situation where masks need to be worn, it's best that everyone is wearing a mask in that situation, and then that will allow everyone to be protecting others around them from their own droplets. I also really just want to briefly touch on gloves. There's some discussions around gloves. Obviously, if you would normally wear gloves in the course of your duties, then you should continue to do that. but gloves are not seen as a protective measure for COVID. And the reason is because you don't transmit the disease through your skin. Your skin is actually a very good protective barrier. You transmit the disease through your mouth, your eyes, your nose. So if you are wearing gloves and you are touching surfaces or getting the virus on your gloves, and some gloves will actually pick it up more than your skin will, and you're still touching your face, you're still transmitting that disease potentially within your body. So we don't necessarily recommend gloves as a protective measure or control measure for COVID, but we also want to recognize that if you would normally wear gloves in the course of your duties, that you should continue to do so. So let's talk a bit more about PPE. We'll go on to the next slide here, Ruby. And this would be a situation in vehicles where PPE and wearing masks may absolutely be appropriate. Obviously, if you, as part of the duties within your business, you require people to be in vehicles, either a bunch of co-workers or possibly workers in the public, like maybe a whale watching outfit where you're transporting the tourists from your main office down to the boat, and they're all in a vehicle. If you have a large enough vehicle where you're able to maintain physical distancing between people, that's great. But we also recognize there's lots of situations that you can't do that within the vehicles, and therefore physical barriers could work, although you need to ensure you're not contravening the Motor Vehicle Act by installing physical barriers, but you may, in this case, want to be using masks. And everyone, again, as I said, should be wearing masks in that situation. There are some people that can't wear masks for obvious reasons. They might have a medical reason, they might have a religious reason, and you need to potentially accommodate in that situation. And then you also want to ensure that you're doing proper cleaning of the vehicles, cleaning and hygiene of the frequently touched surfaces like door handles, window, the buttons that put the windows up and down, steering wheel, shift knobs, turn signals, things like that, seat belts. Stuff like that. And so let's actually go to the next slide where we'll talk a little bit more about cleaning and hygiene. And this is where we get into your cleaning and hygiene practices as an employer. Now, a lot of you as employers probably had cleaning and hygiene practices in place already, but this is where we want to talk about adequate hand washing facilities on site for the workers to ensure that those locations are easily visible and accessible. Developing policies and procedures around hand washing, like ensuring that workers are washing their hands when they arrive at work, before and after breaks, after handling cash or other materials. You want to also ensure as an employer that you're providing the supplies like soap and water, hand sanitizer, disinfectant wipes, nitrile gloves, garbage bags, and other sufficient washing facilities. Implementing and cleaning protocols for all common areas and high contact surfaces. So you want to make sure that you've got policies and procedures in place and that your staff are trained to ensure that they understand when that cleaning needs to occur. And then also removing shared items. Again, I talked earlier a little bit about coffee, food, shared food, snacks, things like that. Water dispensers. If this is something that you would typically offer within your workplace, maybe look at alternatives, single serving alternatives where you may be able to still offer it, but not have a water dispenser where people are touching the spout, or the coffee dispenser where people are touching the spout on a regular basis. Next slide, please. Thanks, Ruby. So after you've gone through developing your control measures, you want to ensure that you have policies in place. And this is step 3. So ensuring you have policies in place in order to support the control measures that you have designed and developed, such as when workers should or should not be in the workplace. I talked on the last slide about hand washing practices and when it's expected that workers will be washing their hands. So ensuring that you have those policies in place is going to support your COVID safety plan and ensure that you've got robust justification if any issues are to arise in the future. Next slide, please. So we go on to step 4, and step 4 is really around communicating your plans and training your staff. So I spoke earlier about including your workers in the process, but if you've got a lot of staff, you're not necessarily going to include all of your workers in that process. You might be including your joint committee, or you should be including your joint committee, worker health and safety representative, or others. Once you have your plan in place, though, you need to ensure that all of your staff, your entire workforce, and possibly even the contractors and service providers coming into your workplace are aware of what your plan is. Communicating that plan is key. And again, it will go a long ways to allaying the fear, but it's also a responsibility of you as the employer to ensure that any control measures you put in place to reduce the hazard or risk associated with COVID, that your workers are aware of that, and that they're also trained on any new protocols that may be put in place. that you're posting signage to remind them around hand washing, for example. So it's really important in step 4 that you are communicating your plan out to your workers. Step 5, if we can go on to the next slide, is around monitoring your plan. So you shouldn't just be developing a plan, putting it off to the side, and then forgetting about it. You want to always be revisiting it. There may be new orders that are written by the Provincial Health Office that need to be taken into account. There may be new protocols available. You may find from your workers that some things just aren't working in what you had put forward. And here's an opportunity for you to be able to revisit that on a regular basis and ensure that your workers' input is being included. And then step 6. Step 6 is kind of almost outside of the context of COVID in a way, but we recognize that many employers shut down for a period of time, are starting to resume their business. There may be certain risks that are now resuming. They're now becoming apparent as you resume your operations. Maybe you had machinery that typically ran 24/7. You had to shut that down for a number of months, and now you're starting it back up. What risks might you be creating? You might have vehicles, for example. Again, going back to that whale watching outfit, your boats might have been sitting idle for a while. What sort of maintenance, what sort of risk are you putting into place by getting those machines back up and running? You may also have staff that just started working with you before you shut down back in March or April. You would put them through all the training, the orientation. They've probably forgotten a lot of that while they've been off. And so thinking about your staff and what training and orientation might need to be redone for those workers is really important. So if we go on to the next slide, please, Ruby. And you'll all get a copy of this PowerPoint afterwards in PDF form. The links here are live. They will be active within the PDF. These links here bring you to a fillable PDF for the COVID safety plan. Again, I mentioned that if an officer comes out and does an inspection in your workplace, they're going to expect that you've gone through the 6 steps. You don't have to use our template. You don't have to use what we have on our website, but it is expected you will have gone through these 6 steps and put some thought into those 6 steps. So this template available on our website will walk you through those 6 steps in a checklist type format, give you lots of space to fill in information and put together your plan. So I do recommend you take a look. It's also in that note on the bottom of the slide there. You'll also note that it is available through our WorkSafeBC virtual booth, which you can visit during this event. And you'll also see a number of articles of various employers that have implemented their plans and how they've done that through our latest edition, our July-August edition of the WorkSafe magazine, which is also available at the virtual booth. Next slide, please, Ruby. So this is where we talk about workers' responsibilities. So you've put together your plan, all of that's out there, ready to go, and you need to, as workers, need to ensure that you are following the plan that is put in place. That you're not coming to work if you're sick, that you're complying with the employer's instructions and training and protocols that they've developed, and also minimizing your exposure outside of work. But we also need to recognize, and employers need to recognize, that workers have 3 main rights. They have the right to know about hazards in the workplace, they have the right to participate in health and safety activities, and they have the right to refuse unsafe work. Those first 2 are really covered by their involvement in the process of developing. The last one, refusal of unsafe work, they have the right to do that, and you need to go through those steps as an employer if anyone does bring forward the refusal of unsafe work. There are steps very clearly laid out in the regulation, and that last step, if you're not coming to resolution with your workforce, is to contact WorkSafeBC. So ensure that you are aware of that as an employer. Okay, next slide. You can actually jump 2 ahead here. I've only got maybe about 10 slides left, which we'll go through fairly quickly around how to access resources. This is right at the top of our home page on our website. You'll see a listing of protocols that we have developed. Lots of protocols available. You'll see sort of circled there the small business one. So if you go to the next slide, Ruby, this will give you an idea of how the protocols are organized. So under small business, we have a number of different categories of protocols. So understanding COVID, who should come into the workplace, working from home, physical distancing. And when you click on all those, they're all drop downs. It'll give you a list of protocols. Those protocols are meant to be guidance and help you put together your COVID safety plan. They're not requirements. We can't write you an order if you haven't implemented one of the protocols that's on there, but they are meant to be guidance and meant to help you as employers. Now there's, as you see here, there's small business, but we have developed protocols for 30 plus different industry groups. And we feel that pretty much all employers in the province will be able to align themselves with one of those industry groups from an activity and task perspective, and be able to come up with some protocols that will help you as an employer moving forward.
Hi everyone. So I think the storm outside is interfering with a lot of people's internet, unfortunately. So I'm just gonna go through the questions and try to answer them to the best of my abilities. And then when Chris is back, there we
There
go.
we go. Yeah,
Chris is
my
back.
apologies. I don't know what happened there. My apologies.
That's okay. The storm is interfering with a lot of people's internet. So maybe we can wrap up the presentation and address some of the questions, Chris.
Sure. Yeah. Let's do that. And you'll be able to share these slides, Ruby, correct?
Yeah, I can send in the post-event survey.
Great, in PDF form, and that would be great. So again, the following slides have just a lot of access to resources that you have available to you as an employer as you're putting together your plans. So, anyways, I will end there. My apologies for losing connection there for a few minutes. I know that put us a bit behind, but I'm happy to address any questions that you may have.
Okay, great. Thank you so much. So there are quite a few questions. I'm just going to go through with them with you if that is okay.
Yeah.
So I see here from Dana, people working in offices with no possibility of having the windows open, are they more at risk even using masks and keeping 2 meters apart?
Not necessarily. What you do, so we do actually have some guidance on our website around ventilation. So I do recommend, in fact, that slide that I showed that has the right at the top that showed all the industry protocols. There's access to resources as well, and one of those resources is a frequently asked question approach to ventilation and airflow within your workplace. So I do recommend you take a look at that. It's a couple pages long and it provides a lot of background on ventilation. So you do need to ensure, even prior to COVID, you need to ensure that your ventilation system is engineered appropriately and working appropriately. So that document will guide you through the ventilation situation related to COVID.
Great. I will ask my internal colleague, Darren. Darren, if you can find that ventilation WorkSafeBC article and link it in the chat, that would be great. We have another question over here from Danita. Hi, Danita. Nice to see you again. What if you are incorporated but work at home and the employees at the company are you and your spouse only? We're obviously in the same social bubble. How stringent do we need for our written plan?
Yeah, if it's just you and your spouse, it is quite possible that that you actually don't fall under the prevention aspect of WorkSafeBC. So it's best that you do call WorkSafeBC to understand what that employment relationship is, to determine whether or not you need that COVID safety plan. Now, let's say, for argument's sake, really kind of, I guess, getting to your question, is if you are determined to be an employer and not an owner operator in that situation, and it is just you and your spouse, and you are within that bubble, obviously, if an officer was to come out and do an inspection, that would be taken into account from the officer, and they would understand that. We're taking a very consultative approach to this when we come out and do our inspections. So that would be taken into account. And as long as you've considered the 6 steps and you feel you've put in adequate control measures, then that's what the officer will be looking for. And if you are already in that social bubble and within the same business or within the same family, then that 2 meters of distancing isn't going to be the same requirement, and the officer will understand that.
Okay, great. A couple more questions. Kelly asked, does the public, being a customer, have a legal right to review or ask about their COVID-19 safety plan? For example, grocery stores, I typically see signs but no enforcement or protocols, such as maximum number of people, directional flow in aisles, etc.
So part of the public health order that was written on May 15th and is available on the PHO website does state that the employer's COVID safety plan has to be available to anyone that would come into that place of business, which would include the public, assuming that they are patrons of a restaurant or a grocery store. It does need to be available. Now, how you make it available is not necessarily laid out in black and white. It can be on your website. It could be posted to your front door. It could be available through other means if you think that's appropriate, but it does need to be available to anyone that would come into the workplace. So yes, they can have access to that COVID safety plan. Now, again, I mentioned earlier that if you've got a really robust plan, maybe it's 20 pages long, maybe it has workers' names in it or other things within there, that doesn't necessarily need to be provided. And you may run into privacy issues there anyways, but there needs to be an understanding for the general public on what your COVID safety plan is and what measures you put in place to protect your workers and to protect the public.
Great. We also have a few questions in the chat box. I'm just going to scroll up. So Sally asks, I am a sole entrepreneur and I'm going to be opening up a new place. There will only be me and maybe one other employee. Do I have to have a safety plan?
Sorry, can you repeat that?
Yeah, so Sally asks, she's going to be opening up a new place, but she's a sole entrepreneur. It's only going to be her and one other employee. Will she need a safety plan?
In all likelihood, yes. If you have an employee, basically considered a worker under the Act, then you would not be an owner operator. You would essentially fall under our mandate, our prevention mandate, and would be required to have a COVID safety plan. But again, if you have questions about this, every situation is different. So if you have questions, it is best that you call WorkSafeBC, talk to our assessments department. And the assessments department will be able to help you make that determination.
And also visit Helen at the virtual expo. Helen Chandler is very knowledgeable and she'll be there as well as her colleagues to answer any questions you may have.
I will also say, sorry, Ruby, if I can just add to that too, because I didn't get through all the slides because I got kicked out there. We do have our prevention information line, which is really important as well. And you can call our prevention information line. Helen, maybe you can put it into the chat box here, 604-276-3100 in the Lower Mainland, 1-888-621-SAFE, toll free from anywhere in BC. We have officers that are supporting that prevention information line. If you call that line, you can ask these types of questions as well, and we will be available to answer them. Again, we are taking a very consultative approach to COVID, and we are here to help employers as best as we can to comply with the requirements of what we're going through right now.
Great. We have two more great questions, and we might be a little delayed, but we're going to go through both, hopefully. So Lisa asks, am I required to create a COVID-19 safety plan if all work is done from each employee's home? There is no common workplace. That's a great question, actually.
It is a great question, and the answer is yes. You are still required to have a COVID safety plan because you have workers. And that COVID safety plan would essentially be outlining the protocols you have in place for people working from home. And again, a couple slides that you'll see in the deck when you have a chance to go through it speaks specifically about working from home. And the employer, even though your workers are working from their home environment, the employer still has a responsibility to ensure the health and safety of those workers as they are doing tasks, as they're doing their general duties from their home environment. And so you need to ensure that you have policies in place as an employer for workers working from home. You need to ensure that they've gone through a hazard assessment. You need to ensure that they have considered emergency procedures. You also want to consider the ergonomics of the home environment. Have your workers do an assessment and then talk to your workers over the phone or over Skype or whatever it might be about their assessment of their workplace. We also have a great resource, which is likely available through our virtual booth here as well, called How to Make Your Computer Workstation Fit You. Provide that to your workers. Have a look at it as an employer. It'll help your workers set up their workstation at home. Taking breaks throughout the day is another key piece. When you're at home, it's easy to roll out of bed, come down to your home office, and not come up for a breath until dinner time. And that's just it's not healthy. It's not safe for us. You should be practicing the 20-20-20 rule. So every 20 minutes, standing up for at least 20 seconds and looking about 20 feet, 20 meters away from your workstation to relax your eyes, relax your muscles, and then get back to work, and then taking some more extended breaks throughout the day if you have sort of that full typical 7.5 or 8 hour shift. So really, really important that employers understand their responsibilities, even if they have workers working from home. And yes, you are still required to have a COVID safety plan in place.
Okay, great. Thank you. We're going to do one last question, which is a really great question. They got a thumbs up. So Greg asks, thank you for this excellent presentation. As an association of personal service establishments, can we advise owners and staff on measures they can take as winter sets in? For example, how to deal with coats, gloves, closed doors and windows, and cold weather, where clients should stay longer to have their hair dry properly. Thank you.
Yeah, absolutely. I mean, I think as we get into the winter months here, there's a number of places of business that are going to have to adapt their COVID safety plans as a result of this. I mean, think about all the restaurants that had their patios open. Well, some of them are probably considering closing those patios now and putting heaters in and putting in other, I'll say, I don't want to say control measures, but other changes to their workplace, which are now going to potentially present other risks for the workers and for the general public. So personal services establishments like hair salons, and the fact that people are going to be coming in with toques and scarves and big jackets, what are they going to do with those? Where are you going to put them? Who's going to handle them? So employers should absolutely be revisiting their COVID safety plan as we are moving forward here, and considering those types of changes to the workplace and how that's going to be dealt with from a COVID perspective. And any of the associations out there, and I understand this question is coming from an association, any of the associations out there, you're in a perfect position to be able to help your membership, help your employers with these types of risks. My team at WorkSafeBC, we are available and accessible to be able to help industry associations provide support to their employers. So please feel free to contact us. The final slide on the slide deck, when you get it, has my contact information as well as our general inbox for my team. And again, the prevention information line is a great resource for any of you to contact us and get the information that you might need.
Great, thank you so much. There are a bunch more great questions, but we're running out of time. So please visit Helen at the virtual booth, and she will try her best to answer any questions you may have. Thanks, Chris, once again for doing this presentation with us. And please tune in at 11:15 for our finance session on managing cash flow.
Thanks, everyone. Appreciate it. Have a good day.
Too.